All right, good evening, West Point families, friends, and everybody out there, all our teammates. For some of you who haven't tuned in before, this is our West Point Town Hall, and I really want to thank you and appreciate you dialing in. First thing I'd like to say before we get started tonight, I want to introduce Lieutenant Colonel Mike Greifenstein, our Chief of Public Health, and Colonel Brett Venable, our Hospital Commander. Tonight, our goal is to lay out the current situation we have here at West Point, here in the community, for all the families, our teammates, all our friends, and giving you an idea of what actions we've taken place over the last couple of days. Before I get started, though, the first thing that I really want to drive home is, after 18 months of being the Garrison commander here, I am so appreciative and so thankful for all the hard work of everybody out there. I know right now is an extremely stressful time, but I will tell you, the civilians, the contractors, our professors, our coaches, all the administration here at West Point, the leadership, everybody is 100% focused on protecting the force and taking care of everybody here. And I'm honored to be a part of this team. My family is here with you, and there's no other place in the Army that I'd rather be than sitting here right here in front of you here at West Point. To give you an idea of the battle rhythm over the last couple of days, the superintendent has laid out some pretty explicit guidance to the whole team here at West Point. My team, the Garrison, along with Brett and Griff, we have been focused on protecting the force. And really, that's the day-to-day grind. We're trying to make sure everybody's safe, get all our employees on base safe, take care of everyone, and make sure we're being protected during this time. The other half of the team here at West Point is looking at the long-term plan. We have absolutely the greatest professors, the best professionals, using all the skills they have, whether it's math modeling to look at the virus, and everything else we have to conduct mission planning to prepare us for the long term. So tomorrow that'll kick off at about 12:30 with the first portion of the mission planning for the long term, where we're going to drive the academy and where it's going to go, will be presented to the superintendent. But we have the best and brightest here across the board of everybody here, driving hard to make sure we're safe and move forward in a positive manner to take care of everybody here. Every day we have an 11 o'clock briefing across the board that is open for everybody on the entire academy that lays out what we're doing for the day and where we're driving. Before every one of those briefings begins, Colonel Mike Greifenstein here, our Chief of Public Health, has been giving us a rundown strategically across the globe, across the country, across the state of New York, across Orange County, and across West Point, what the status of the coronavirus is and how that may or may not affect West Point. So what I've asked Mike to do tonight is, if he could, give you a quick snapshot of what he's been telling us every day to try to vector it in for you so you can kind of understand what we're seeing here as leadership and the rest of the team. And with that, I'll turn it over to my brother, Mike.
Hey, thank you, sir. I appreciate you having me out here tonight, sir. Good evening, West Point community. So a lot's changed since the last time we had a touch point, and that was during the town hall that Colonel Marson held on 5 March. So what's changed since we last spoke? On the 11th of March, the World Health Organization made the coronavirus 19 or COVID-19 a pandemic. It met the third criteria out of the 3 criteria that the WHO uses to check that. And really what was occurring was sustained community transmission on numerous locations across the globe. And that prompted them to make that declaration. With that, our president took swift action, noting that most of the cases, instead of being in the Hubei province of China, were now occurring in Europe. And Europe was really starting to blossom with COVID-19 cases. So he cut off travel to and from that location and asked the CDC to issue a level 3 travel advisory to the European continent. That has since restricted travel for folks coming in to 13 known locations in the United States where they're medically screened to determine whether or not they're symptomatic for COVID-19. Following that, on the 13th of March, the president issued a national emergency message for COVID-19. If you remember back when we last spoke on the 25th, one of the things that was changing out there, or excuse me, on the 5th of March, what was changing on the 25th of February was the verbiage by the Centers for Disease Control and Prevention. For the first time, they were saying the words "yet" and "community spread" with COVID-19 cases possibly occurring in the United States. Since that message, we've started to see cases starting to pop up in the United States, with New York having the most cases to date. The first case that occurred here in Orange County occurred on the 13th of March, and we're steadily seeing cases rise. This morning, the case count was 11. By this evening, it's 18. We're keeping a beat on that and watching how the Hudson Valley develops. Yesterday, the President of the United States issued a 15-day slow the spread message to the American public that I hope you've had a chance to see. What he asked for us all to do was first to listen to our state and local authorities. As this time progresses, we really need to be cognizant of what we're putting out and what we're saying so that we can keep everybody safe and keep the community together. Also, he was driving home those same forced health protection message that we used at the town hall, those mitigation steps that you can use at home to help stop the spread of any germ, such as proper hand washing, avoiding touching your eyes, nose, and mouth with your hands, avoiding contact with those who are sick in your home, and if you're sick, stay home, disinfecting commonly touched surfaces throughout your home, and then just taking care of yourself holistically, remembering the performance triad. Get good sleep, have good nutrition, and exercise daily. And then his last piece of that message was to protect vulnerable populations. What we've noted about COVID-19 to date is the fact that this affects mostly elderly folks, 60 years and older, those who are immunocompromised, meaning that they have an existing condition, or they have comorbidities, meaning that they don't live necessarily a healthy lifestyle. Those factors into how drastic of toll that COVID-19 takes on that person. So he's asking that we protect those populations and be cognizant that if we are sick, that we have the potential to bring it to a population that could have negative consequences and more drastic effects. And yesterday, you might have noticed on the news that the governors of New York, New Jersey, and Connecticut came together and made a joint decision to start to reduce the ability for us to gather socially and in communal settings, in restaurants, in bars, and in movie theaters. Limiting those facilities to less than 50 people at any time, or closing them altogether. This is an effort to flatten the curve. And we mentioned that briefly on the night of the 5th, but I'd like to talk a little bit about that more right now. So as we watch any disease progress across the world or across a country, we're always cognizant of the epidemiological curve. How many cases are occurring over a period of time and how much we expect for that disease to keep prolificating. So what we're asking you to do is to follow these measures of social distancing and reducing communal settings and taking the forced health protection measures that I previously mentioned so that we can flatten the epicurve and reduce the number of cases holistically. And why is that important? Not for a number alone, but we need to monitor the number of cases because our local hospitals and our medical care facilities can only see so many patients at a time. So all the steps that you can do at home will help flatten that curve. So let me walk you into where we are, both in the country and in the Hudson Valley here. As of this morning, at the update to the superintendent, we had 967 cases here in New York State. That's since climbed to up over 1,000. We are the leading state in the nation for cases, with the other two behind us being Washington State and California. And you may ask why the cases are occurring there. Some of that's due to travel, and some of that's just due to population density. As for the Hudson Valley, as I previously mentioned, we have 18 cases here in Orange County, and some of our surrounding counties are starting to see cases as well. Sullivan County had its first case today. Rockland is up to 16 cases. Westchester County, where New Rochelle is, where you may have seen on the news, is up to 220 cases as of this morning. To our south in the city, we've seen a larger number. Holistically, the city itself, as of this morning, had 463 cases, and some cases out on Long Island, in Nassau and Suffolk County, 109 and 63 respectively. Together, we need to keep up the spirit. We need to have a combined effort to beat the germs. I asked you that on the 5th of March, and I continue to ask for your help with that. Together, we can actually stem this. We can beat it, and we can reduce and flatten the epicurve. And with that, sir, I'm going to turn it back over to you.
Okay. Thanks, Griff. So as Griff just laid out, that's kind of the picture that's ahead of us and what we're facing right now. So based off that, I'll give you a few more additive things that we've done as well. Both myself and the superintendent have spoken to leadership in both Korea and Italy. They're about 3 to 4 weeks ahead of us. I've gotten every playbook and every guide on clean teams, trace teams, to diagnose the problem that they're wrestling with in Korea, and we have those here at West Point, and we are implementing those systems to prepare us and get us ready in case those requirements are needed. A couple actions on post that we've taken since all this has come to pass is, bottom line, we have closed West Point to visitors right now. That was a decision we made a couple days ago. We've also closed the visitor center and the museum. However, the VCC is still open. All sporting events have been canceled. All restaurants on post are grab and go or delivery. I walked all those today. Met with all the staffs that are working those. They're doing a phenomenal job of trying to keep the areas clean. They're upbeat. They're motivated. I'm thankful for them, but they're ready to serve you, but they're taking all the steps necessary to keep it clean so we don't gather and we keep our social distancing. All gyms are closed. That decision was made this morning, and that is for right now. And we will drive the train and see where that goes. But as a precautionary measure to keep us safe, we've closed all the gyms at this time. Okay, the CDC. CDC was closed last night. So last night we had an episode occur with one of the CDCs. And I'll try to explain to you what happened and how that came to pass. Last night at about 1700, I was contacted down at the EOC that we had a CDC employee that had been in contact with someone in Orange County that came up positive for COVID-19. That was on the 9th of March. That CDC employee was at Stony CDC on the 12th. On the day of the 12th, that CDC employee in her normal duties had gone around to every classroom. The likelihood of passing that virus was extremely slim. However, that whole crew of families and everybody that was in that CDC, even though that particular employee was only there on the 12th, those same kids, employees that work inside the CDC were again there on the 13th, and then again on the 16th. So when we got notified last night, talking to the medical professionals around me and trying to take care and protect the community, starting at about 20 to 2100, we had the message put together and started to try to get that out to all the folks that had kids and employees that worked inside of that CDC. All right. If you had a family, if a child or one of your employees that worked inside the Stony CDC, from about 2000 to about 03 in the morning, you were getting text messages and messages of contact that, hey, you needed to be quarantined and you may have had contact with somebody that may have had contact with COVID-19. If you were down in the Lee CDC, all you got was a message that the CDCs and the CYS were closed. So that is why you were not contacted over the night, that you needed to be quarantined, and that's why that was different. That CDC employee right now is quarantined and has been tested for COVID-19, and we are waiting on that result. Our team COVID, which right now makes up of our public health nurses, our safety team, members of the band, and our DPW, are starting the process right now with the MWR and our CDC workers to trace the activities of that CDC employee, watching video from inside the CDC, taking interviews, to make sure we have a very clear pattern of life for that CDC employee so we can specifically know where that employee went and exactly who she touched and who she had access to. I understand and I fully appreciate that quarantining 75 employees and 129 families is extremely difficult. We need all of you back here at work to help the rest of the team. That said, we are going above and beyond right now to make sure that we take all precautionary measures possible to take care of your families and take care of everybody here on base. I'm extremely sensitive that you have to be home, but we have to take precautionary measures. So I appreciate your patience dealing with us on that. Simultaneously here at West Point, we just got off of spring break. We had an extremely large number of our residents here travel overseas to level 2 and level 3 countries. That has caused an increased band on all our quarantines. And I understand 99.9% of our families here are asymptomatic, but this is a precautionary step that we're taking to make sure that everyone is safe and everybody in the community does not get affected by the virus. Again, very draconian, I understand, but it's a precautionary measure that we're taking to be safe. Speaking with the leadership in Korea and in Italy that are currently dealing with this crisis, their recommendations have been be proactive, move quick, be deliberate, but err on the side of caution when it comes to quarantining folks and taking action. And we've tried to do that to take care of all of you. So the folks that we have in here working every day are productive and are moving forward, trying to get the best plan forward to take care of all of us. As soon as these folks come off of quarantine, we're getting you back in here, and we need to get the team together and keep driving forward. Let me talk about the commissary, the PX, and the shopette. I know today you saw quite a different signature if you traveled there. This morning I'll talk about the team Overwatch. That is a plan that we took from the folks from Vincennes and Korea. We've brought our DES firefighters, we've brought our MPs down into the areas of the commissary and the PX, and that is really to monitor social distancing. We're trying to keep the amount of folks inside the commissary and the PX to 50 people. The MPs and the firefighters are just trying to make sure we're organized and we get everybody nice and smooth inside of both those facilities. They're also monitoring to make sure that the commissary and the PX are cleaning on a set schedule to make sure that all those areas are being cleaned to keep it safe for everybody to operate in there. The absolute last call that I'm going to make is trying to close the commissary and the PX. Those are our lifeline. We want to keep both those facilities open. I spoke to both Carol and Katie, and that team is working phenomenally hard. I walked down there today, met with residents. I appreciate all the residents, the retirees, the family members I spoke to. I appreciate your patience and your kindness. And more importantly, I really appreciate the employees of both those organizations for all the great work you're doing. You're taking care of us. And God bless you for coming in and doing all your great work. Right now, we do have shelf limits that are being monitored. I know one of the questions out there with all the folks that are being quarantined, how can I, as a sponsor, go into the commissary and PX and get stuff for my teammates that are currently being quarantined? I understand that. We are working through that right now. We are going to develop a list from all the different organizations to bring that into the OC as quickly as possible. And I'm going to sign a piece of paper for every one of those sponsors so you can increase your shelf limit to make sure that you can account for your families and friends that you're taking care of that are currently being quarantined. And we are working at it right now, and we'll have a solution on the street very soon. The other piece I'd like to highlight is we are also working extremely close with Orange County. I've got one of my best EMS guys, Chris Hennon, right now working inside the Goshen Orange County cell. Today, during our battle update brief, Mr. Steve Newhouse came in, briefed the superintendent and the entire team on all the activities that Orange County are doing, and we are staying in close touch with Orange County to make sure that we're working together, and we will continue to update you on all the things going on in Orange County as we get them. And then the last thing I'd like to say before I pass over to Brett is that the number one thing that I am currently focused on right now is the protection of you and your families and everybody that works here. We've got to maintain our social distancing. We've got to take extra discipline, precautionary procedures to take care of each other so we can plan and we can focus and take care of each other. And I'm very appreciative of everything that everybody's out there is doing, and all the teammates around me are doing all the great work. Before I go further and start to answer some questions, I want to let Brett give a chance to speak to the team here, explain everything that Keller Hospital's doing and some of the steps he's taking to take care of all the folks here across the community. Brett?
Hey, thanks, Cecil. I appreciate it. Good evening, everyone. So I really just want to take a couple minutes to talk about some of the measures we've taken at the hospital to protect our community and also protect the hospital staff. So number one, we're enforcing social distancing at the hospital. So if you visit primary care, the Keller pharmacy, or any other clinic in the facility, you'll notice that the waiting rooms are arranged very differently. So we have a minimum of 6 feet distance between all seats in the waiting areas, and this puts us in compliance with CDC guidelines, and it also helps to protect all the beneficiaries as well as the staff working in the facility. Number two, you'll notice when you call the Keller appointment line, our call center staff is pre-screening patients with a questionnaire. So if you're identified as high risk for COVID-19, you'll be directed to stay home, and then a public health nurse will contact you and provide further instructions. Number three, if you visit the hospital, I think many of you have already noticed that we have large signs outside with pre-screening questions, and these are posted at each entrance of the facility. So if you answer yes to any of the questions on the questionnaire, you'll be directed to a screening station, which is located just outside of the side entrance of the emergency room. Once directed to that screening station, you'll be evaluated by a provider, and then they will provide you further guidance, which may include self-quarantine or isolation if applicable. One of the main takeaways for this evening is that if you do have COVID-19 symptoms, please do not come to the hospital unless you have emergency situation or if a healthcare provider directs you to do so. Okay, that's for the safety of you as well as the staff of the hospital. So if you are not feeling well, you have COVID-19 symptoms, you need to call the nurse advice line. It's 1-800-TRICARE, and then you'll press option 1. Once you call that line, a registered nurse will answer the phone, and they will guide you through the next steps for coordinating your care. One nice thing about the nurse advice line is that they can actually book appointments at Keller through that nurse advice line. They can also facilitate referrals out to the local network. If you're not a Keller beneficiary, the guidance is to contact your local PCM off post. As you all know, Keller, we're dedicated to taking care of this community. We're dedicated to taking care of our patients, dedicated to taking care of our staff. If you have any questions at all, please don't hesitate to bring those up so that we can answer them tonight.
Okay.
Thanks, Cecil.
Thanks, Brett. Okay, folks, before we start the question and answer period, just a couple things to highlight. I'll do this town hall again tomorrow night if I don't get to all your questions, and quite frankly, I'm not going to be able to answer them all. I know there was going to be a lot of questions. I believe Thursday we're going to get ready to start the virtual learning at the Dodea schools here on post. I've talked to Miles Shea and Denise DeMarco. I will bring those folks in. If the questions that come up are related to the school, I'm willing to bring those folks in or one of their representatives to talk through the virtual learning. I know that's going to be a challenge as we get that off and running. I've talked with Dr. Frank Sheboy at James I. O'Neill. Hey, I know that starts on Monday with all the high school kids we have there. If I need to bring a representative in from Highland Falls and from the local school district, I'll bring him in and talk about the virtual learning forward. If you're a civilian or retiree out there and you have questions about leave status and what does it mean, why don't I call a code red, or what summer and winter leave are, I'll bring a CPAC rep in. I will really, hey, if you got questions about West Point sports and practice and when Coach Munkin's going to go out there and get after it again and start winning games for us, hey, I'll bring in a representative from the athletic department, and they'll talk about that for you to explain how all that stuff works and where we're going to go when we go undefeated next year. So I'll bring in whatever experts you need to come and answer any questions you have. What I would ask is that we go through this process as you tee up those questions. My team throughout the day will look at them, we'll rack and stack them, and I'll try to advertise prior of kind of what that focus for that discussion will be, and this thing will morph over time as we continue down the road. So that is what I'm going to attempt to do. And as the superintendent and I talked about last night, this forum is for me to be as transparent as I humanly can be to let you know what's going on. I will tell you, I do not have all the answers. I'm not a pandemic expert, but I will tell you, I will work as hard as I can, and the team beside me and all of you on TV that are coming to work every day, and all the folks doing all this work and teleworking from home, everybody's driving to the same purpose. All the coaches are keeping in contact with their cadets. The entire team here is doing the best they can to deal with this crisis and get us driving forward. But we are in the best place to do it, and we are the best team to make it happen and handle it. I'm assured of that fact. Okay, so with that, I've got a screen over here, and I'm going to start reading some questions off. And please jump onto the Facebook Live page, and Brett and Griff and I will go back and forth and try to answer these the best we can. So the first question I have up states here, if I have a retiree ID card but don't live on West Point, can I still use the commissary and PX? Will I still be able to come through the gates? The answer to that question is a simple yes. Okay? Yes, you can. Okay? Next question. Can you scroll down a little bit? I can't read it. Okay. Okay, this question is, West Point still notifying applicants whether they've been accepted for the class of 2024? I will tell you that is a question for Deb McDonald, our phenomenal admissions director. I don't have that answer for you tonight. We're going to get that question answered, and then we'll get that posted on the Facebook page. If I get a lot of questions that are admissions related, hey, at some point in the very near future, we'll get Deb up here and she can answer you those questions, okay? But thank you for the question. Okay, next question. I don't have access to the PX. Can I still buy food at Burger King and other shops in the PX building? I will tell you right now, I need to look at that question. I don't have the answer for that. currently right now. If you don't have access to the PX, you don't have the authority to be in the PX. But I'll look at that, and I'll answer that tonight to give you a better answer. Okay. Next question. Why is the base not closed for 14 days? Let's worry about protecting everyone who is on base, including the workers. Okay. So we're taking these the security and protection of the base extremely seriously. Why didn't I just automatically close the base and shut it off to everybody? Well, that's a very deliberate decision. West Point, hey, we're the symbol for the country, we're the symbol for the Army, and closing this base means something. So that's a big decision. That weighs heavily on me, and that weighs heavily on the superintendent. Right now, the risk is low minimal. Right now, we're at a health pecan level of Bravo, right? And based off what I'm getting from my professional experts. However, we have a lot of folks in the community that depend on us to come here. Retirees, all our workers. We have to be able to let folks come on the base to make sure our commissaries, our shop ed has supplies. Right now, we have one of the best 2 facilities here to take care of all the families as far as getting food and water. Other areas in New York, especially the city, are having difficulty getting these things. So there's a lot riding on whether or not we just close the walls and shut the doors here at West Point. If that call needs to be made, we are looking at that every day, every second, whether we're going to do that. But that is why we have not made that decision yet, okay? And if I haven't answered that question for you better, write it again, and I'll put some more detail and send you out a note, okay? The next question is, thank you for changing the ID card policies at the gates. I appreciate you keeping my son and all the guards safe. Hey, bottom line, we looked at, that was our initial stab for the gates. I really appreciate that comment. We looked at what they were doing in Korea. We also looked at what they were doing in Italy, looked up at Fort Drum, and also saw the comments on Facebook. And I appreciate you putting them on there. I talked to the DES team, and I said, hey, what's the better way of doing this? This is what they're doing on other bases. We agreed. We saw what other examples were. That's why we implemented it to do a better job. And I appreciate that comment, and I appreciate the folks posting on Facebook. That's what we need. That's the disciplined vigilance we need, looking at everybody to keep social distancing and the things we're doing here sharp. So I really appreciate you doing that. Are you going to close any of the gates? Not yet, but that is a decision that we have out there. So right now, today, we are not going to close the gates. But could we in the future? Absolutely. A lot will be based on the manning we have here, how many folks we have teleworking, how many folks we have quarantined, what level we have to go to as far as medical screening at the gates for folks to come in. That may cause us to close gates so we can centrally focus bringing folks in so we can test them. So the answer to your question is, potentially, we may close some of the gates. What are you doing? Next question is, what are you doing to protect the staff who are working at the isolation and the quarantine facilities? So right now we have a permanent staff that's focused on our isolation and quarantine facilities. We have 2 buildings on West Point where we have those operations set up. Currently, one of those buildings is completely empty. We have no one in there. One of the other buildings, we currently have 3 cadets overseas that were showing some symptoms. So they are right now isolated in one of those buildings. Right now, we've gone through, off the advice of our medical experts, we have the proper PPE, but we are also working through those SOPs. There are quarantine facilities in Korea and in Vincenza. They're quite far along in this process. We have all their standard operating procedures. Right now, we have some leadership from the band and from the public health nurses that are overseeing and shepherding that project to make sure we're running that properly, to take care of our employees, and more importantly, make sure we're taking care of all the folks cleaning and everything else we're doing in there.
We also provided an info sheet to all the employees working in those buildings to make sure they understand the risk and how to protect themselves.
And some of the same measures that we use holistically across the community, the same measures that we're asking those folks to do, because relative, the risk is low to those folks.
Next question is, does West Point have the ability to test for COVID-19 at this time? And if not, is there a plan to make those tests available?
Yes, so we do have the capability at Keller to take the samples. We have the test kits, and then we send them to Albany for testing. However, we're not testing everyone that is requesting them. If you come in and you are deemed that you need the test, that recommendation is going to the chief medical officer of the hospital, who is following guidance from Orange County before submitting those tests to Albany.
Thanks, Brett. Okay, next question. What can I do while I'm quarantined? Can I walk my dog? The answer to that question is absolutely. You can walk your dog. It's better for you to be outside if you're in a quarantine status. You just have to make sure you maintain social distancing. You don't go into any crowded areas of any gatherings. But hey, if you live up in Lusk or if you're in Lee or up in Stony and you wake up in the morning, you're quarantined, and you walk your dog down the street, stay away from folks. Or if you go down to Shea Stadium, please go do that. We want you to get outside. It's better for you. But yes, you can absolutely walk your dog. Good question. Thank you. If I have family members with a visitor pass, will they be able to visit us, or are they restricted from post? Okay. Okay, hold on. Go back down a little bit. So let me read one more time. If I have family members with a visitor pass, will they be able to visit us, or are they restricted from post? Yes, if you have family members, they will be able to visit you if they are here. All right, you have to get them and bring them in. However, if you're in a quarantine status or an isolated status, the answer would be no for that question, okay? That is our current policy now. That could change in the future depending on what happens. But now, yes, you can get them in. Are you still hiring new employees? If you are, how will they get on post to start work? Okay, the answer to that question is yes, we are still hiring new employees. I have to talk to my CPAC. I believe there's some new guidance out there that they have to be from the immediate area, I believe, but I owe you an answer to that question, and I will get back to you. But good question. Thank you. Can you bring in someone from the CDC to talk about the changes there? The answer is yes, I can. What I would ask you with your question there, if you could come back in, be more specific about what changes you're referencing. But yes, either I can answer that or on the email, on the Facebook Live, or I can bring a CDC rep in. Absolutely. Okay, next question. When will you bring the Corps of Cadets back? I will tell you right now, that won't be my call. As I said, there's a playing team going on inside the academy right now. Our mission analysis begins tomorrow. That decision will be made down the road. Right now, we're trying to gather all the facts. The situation changes drastically, but we will give plenty of information ahead of time when we have that answer and when we're bringing back the Corps of Cadets. But good question. I know there's a lot of families out there and a lot of folks that want to know the answer to that question. Where can I find information about everything that is opened or closed on West Point? You look at the exact same page that you're looking at right now. That is the West Point Garrison Facebook page. Reference that page right there. You can find out everything you need to know right there. Okay? Next question. Okay. All right. You're still typing it out for me. Okay. All right. Okay, folks, this is our first town hall. We're going to have another town hall tomorrow night. What I would ask the community, please, if you can, write all your questions, send questions into the Facebook Live site, and every day we'll try to give you an update. Please, again, put in the recommendations, what you would like to hear about, what you would like to know about, schools, employment, civilian status, anything that it's a question of you that you have. We'll try to answer those questions as best as possible. Again, what I'd like to say before we close off here tonight is thank you, everybody out there, for your patience and understanding. Thank you for all your hard work. I will tell you, I was out today going around trying to see all the folks that are working. I was up at the academy where the folks are doing the planning. I was down at the commissary. I saw the DPW team working on outside the shopette. I saw some of our medical providers. I will just tell you, I'm energized and I'm motivated by the hard work that's going on here. And I'm really appreciative of it. And I just want to say thank you. Okay? With that, everybody have a wonderful night, and I will see you all tomorrow. Thank you.